Breast cancer treatments can significantly impact posture and your overall body alignment, causing the muscles of your shoulder, the neck, as well as the chest to become out of balance. Surgical procedures including mastectomies, axillary surgery, and breast reconstruction, where the tissues and muscles are repositioned, can also alter our body structure. In case of a unilateral or a bilateral mastectomy, the absence of the breast can lead to psychological effects such as shyness and self-consciousness. This often results in an automatic adjustment of the posture, such as slouching forward to conceal the loss of the breast. To address this, in addition to actively working on the posture correction, wearing a breast prosthesis or opting for breast reconstruction can help provide significant support and help improve our overall posture and the body image. Besides surgery, radiation therapy to the breast, the chest wall, as well as the axilla can also further impact our posture, resulting in pain, deformities, and also other complications. Even chemotherapy can lead to muscle mass loss, weakness, making it challenging for the body to maintain a proper posture. Now, addressing these issues proactively is crucial for maintaining functional movement and also reducing long-term effects. What are the common posture misalignment? They are shoulder asymmetry, upper body slouching forward, forward head posture, as well as shoulders drawing forward. What treatment is recommended to improve the posture? One is mobility exercise, muscle strengthening and resistance training exercises, postural awareness, postural correction exercises, as well as thoracic exercises. Posture awareness exercises. Conscious awareness of your body posture is important to maintain and improve the alignment of your body parts. Stand up straight and tall. Maintain a neutral head position. Keep your chin in the middle and eyes look forward. Keep your shoulders down and squeeze in your scapula. Engage your abdomen or tuck your stomach in. Thoracic exercises, thoracic flexion as well as extension. Thoracic side flexion. And thoracic rotation. If you found this video to be helpful, don't forget to like, share, and subscribe.